So tonight's webinar subject from the National Kidney Federation is on foot care, and we have got two leading experts in the UK on foot care. It's a hot topic, just come back from Kidney Week in Edinburgh, where probably one of the most popular leaflets was foot care. So very fitting, and I'm going to hand you over to Joe to kick it off. You're on mute, Joe.
Oh, sorry. I thought you had to unmute us all.
There we go.
It's really lovely to see everybody. Welcome to this evening's webinar. And thank you to the National Kidney Foundation for inviting myself and Ljubisa into this webinar this evening. We're really happy to be here, and we're happy to answer any questions that you've got. We're going to be talking a little bit today about the importance of foot care with kidney disease, but we've also got a little bit of a different slant on it, because we'd like to kind of be able to support you in how you might like to approach us as healthcare professionals to get the best out of your health and care advice from us. So my name's Joanne Casey. I'm a podiatrist. I'm a podiatrist, full stop. I'm also a professional development lead at the Royal College of Podiatry, but I'm also a senior research assistant at the University of Southampton. And then I have here my colleague, Dr. Ljubisa Paden. He's a nurse, and he's a senior lecturer at the University of Manchester. So we're both very excited. Hello, Ljubisa.
Hi, everyone.
So we've got this presentation today, but do put any chat into the any questions you've got into the chat, and we'll answer them probably at the end rather than during it, only because we're not quite able to check the chat as we go. So Pete's going to do that for us. So hopefully I'll start to share my slides now. Share screen. There. So can everybody see that okay? Lovely, great,
Yep,
thank
spot
you. Oh. Lovely. So we were asked to come and talk about foot care and kidney disease, and we thought we'd just put down 4 aims for today, really. One is to highlight the importance of good foot health when living with kidney disease. The other one is to raise awareness of good foot hygiene and foot care and management, to emphasise how patients can support healthcare professionals in the delivery of good practice pathways when we're considering shared decision making, and also then to highlight where you can get help and advice from all the different organisations. So hopefully it'll be a comprehensive session this evening. So the importance of good health when living with kidney disease. We've been lucky enough to be part of developing the National Kidney Foundation's leaflets. So there's lots of leaflets on their website. Do go have a look and take the time out to just flick through those. And I've put links to those leaflets throughout this chat. So why is it important to look after your feet with kidney disease? Well, as you know, kidney disease is a lifelong condition which may cause some foot problems. Some of these problems can occur because of the nerves and blood vessels. So that's including those supplying your feet and legs. With peripheral circulatory problems, so that would what we classify as ischemia, when there's a lack of blood flow to the feet, and that can cause problems such as aches and pains. It can cause sort of symptoms like gangrene, and it can also cause pain. So it's really important that you have sort of checks just to check for any sort of circulatory problems in your feet. And then of course the feeling in your feet might get affected, and that's called peripheral neuropathy, and that would be because the nerves aren't sort of as active as they used to be, and that can come on through kidney disease or living with conditions like diabetes, and it will also come through age. So it's not just really living with kidney disease that can cause a problem. It can be living with other conditions as well. And one of the things that we look for in the foot and lower limb is the circulation. So that would be the arterial supply to your feet. And then we look at the nerves. So that's the nerve supply down to your feet. But also then, of course, we know some of the impact of living with kidney disease. Your filtration system means that you don't always process the fluid properly. And so that can create swelling to your feet and legs. So actually, when we think about the overall impact, we need to be mindful of what particular concern we might be dealing with. So is it the circulation, is it neuropathy, or is it edema? Or actually, is it all three, or is it two of the three? So it's important to really sort of have a foot check. and get your feet checked and make sure that if you are living with edema or a lack of feeling, that you know how to manage those properly. And I'll go through what those foot checks look like through this presentation. One of the foot check is foot screening. So when we think about an assessment, we look to see whether or not you will be at high risk of developing a wound that won't heal or an amputation to your foot. So as sometimes as disease progresses, it can mean that these the risk becomes higher for developing a wound. And it might not be through any fault of your own as such, it can just be through the disease process. But there are things that we can do to check to try and prevent these problems happening. And this is part of this screening this screening tool here. So what we've got is a few risk factors that we can check for. So we check for reduced feeling in the feet. So that's what we mentioned, the neuropathy. And you can see here in the top hand left corner of the screen, we've got a monofilament. And monofilament, it's got a little filament section which touches the skin. It's a little bit like a toothbrush bristle. It doesn't hurt, and it flexes. And that tells us whether or not you've got any sensation, whether you can feel your feet. Because when we're checking for nerves, we've got 3 areas that we check for. We get for autonomic nerves, motor nerves, and sensory nerves. And the sensory nerves are the ones that we tend to check most regularly, because they're the ones that would affect whether you can feel any changes. So if you sort of stood on a stone, or if you developed a blister. So if you went to have a foot screen, what you'd find is they would be checking your feet with a monofilament. If you've got reduced circulation to your feet, that's another screen that we would do. So we'd be checking to see whether or not you've got good arterial supply. Now, there are 3 arteries that feed the foot that come down from, of course, your heart through the arterial tree. And as they sort of reach the sort of midpoint of your lower leg, they kind of split off into 3, and then they kind of have little subsidiaries that sort of feed the skin and tissues, a little bit like a tree root, where a tree root will grow and develop to sort of gain the moisture from the ground. Arteries kind of grow away and then feed the tissues and skin with the blood and nutrients and the oxygen that it requires to function. And so what we do is we will check and we'll palpate as clinicians your pulses on your feet. You've got one on the top of your foot, one on the inside of your ankle, and then there's another one which you can't really palpate with your fingers, but if you were to use a Doppler machine, a little bit like this one here in the screen, then you would be able to palpate it. And it's just sort of at the lower end of the outside of your leg. And those arteries feed all of the soft tissues of the foot and help, enable us to sort of have that nutrients that the foot would need if you did develop, just to function daily. But also if you developed a wound that you would know you would heal okay. So it's important to have your arteries checked. And it starts with a palpation, so using your fingers to test where the arteries are. And then if they can't feel those, they move on to tests like the Doppler. And this one here is a blood pressure cuff, because they'll be looking to measure the pressure in the arm against the pressure in the leg. And then you've also got toe pressure kits, and the toe pressure kits will look at the small micro vessels, and they'll wrap those around the toes. So that's quite an extensive arterial check. But there's some of the things that you might expect if you go and see a podiatrist or a foot health professional or another health and social care professional. The other thing that we check on your foot when you come to see a clinician would be any hard skin on your feet. And that's because hard skin can create pressure and trauma. That you can have sort of areas of slightly thickened skin, which might be from where you're walking. You might have more load, more pressure in those areas. But when it starts to get really quite hard and thick, you need to start considering having that removed or softening it so that it doesn't cause any damage to the underlying tissue. So we would sort of check to see how much hard skin you have, or if you've got any cracks to your skin. We look at the shape of your feet to see whether or not things have changed. So, as we obviously develop and get older, our feet do look a little bit different from when we were sort of younger to where we are now. But have they changed dramatically? Do you have any clawed toes, for example, that might be causing some damage when you've got your shoes on to the skin? Are you noticing that, in your big toe joint, that it's suddenly quite enlarged and it looks like I might have what we'd sometimes call a bunion joint. So we'd look at the foot and sort of look at, sort of just see whether or not things look sort of how they used to look before. So we're just sort of looking for developments and changes. Have you had any foot ulcers before? You know, have you had any wounds that don't heal particularly quickly? Have you ever had an amputation due to kidney disease, you know, due to those complications of kidney disease, so the lack of blood supply or the lack of nerve supply? So, or have you ever had an amputation or an ulcer? Can you look after your feet? Are you able to see your feet? You know, sometimes as clinicians, we sort of presume because there's no pathology attached to the foot, that actually it should be, you know, it will be manageable. But actually, some people can't bend down to get to them, and some people aren't able to see or visualize them. You know, the kidney disease affects the eyes as well, because it's all about the sort of blood pressure, and blood pressure affects arteries. Arteries and microcirculation goes around your eyes as well does your kidneys, as it goes around your heart, your arteries in your legs. You know, blood travels everywhere. So, you know, have we considered that? So when it comes to foot screening, we take all of these things into account and try and sort of weigh up what your risk might be to developing foot ulceration. Also, having dialysis or having an eGFR of less than 30 can put you at risk as well, because obviously your kidneys aren't filtering quite as they were. So actually that can be a higher risk. So it's really, be really mindful of getting a foot check by a healthcare professional such as a podiatrist if you start to have any of these things, and then that's including a low eGFR. So all these sort of foot screening sort of tips can be looked at, found at the on the leaflet that I've got here at the bottom of the screen. So there is obviously having screening by a health and care professional, and you know, if you are concerned about your feet, you know, you can have that done. You can either have some care done in the NHS, or you can sort of see a private practitioner. One of the things that you can do for yourselves at home, if you wanted a, you know, which we probably should be mindful of checking regularly, is a few things here. So one is the Ipswich touch test. So I sort of spoke about nerve damage being a complication that you might find, you know, happens. And actually one way that instead of having that monofilament or having a healthcare professional sort of screen you, if you don't have any screening, then actually you can do an Ipswich touch test. And the Ipswich touch test, I've got a link here so you can go and watch the video if you'd like. But the Ipswich touch test is a gentle test where you press on the big toe, the middle toe, and the fifth toe. You wouldn't press your own toes because you would know when you were doing it, but you would ask maybe a colleague just to press lightly on the big toe, the middle toe, and the little toe. And if you can't feel one of those points, the likelihood is you have got some sort of nerve change. If you can feel all of the points, it's likely that you are able to feel it, just because it's not a quantifiable measure. In other words, we don't know how much pressure we're applying to the toe. We can't say for definite whether or not you have got some change or not, but if it certainly picks up if you can't feel it. So, you know, do sort of ask somebody, if you're sat at home, can you just check to see if I can feel it? But one thing I would say is a good tip, if you feel confident, to either close your eyes or look away, because if you watch somebody touch your toe and they say, can you feel that? And then they touch it, you're likely to say yes because your eyes have seen it, rather than actually because you felt it. So you need to just look away just to make sure that they're doing the fair test. And it might come as a surprise if you can't feel it, but you know, don't be upset. Just take it as a learning point that actually you now need to consider having a proper screen because you might be living with nerve damage. And then to sort of think, well, actually, if I can't feel my feet, what can I do to actually make sure that nothing happens? Because that mechanism from pain to the brain might not necessarily work. So you need to then go, actually, I might need to look, I might need to touch, I might need to, you know, get somebody to review my feet, because I can't rely on the fact that my body's going to alert me to that pain mechanism. And of course, so just be mindful of those things. Visual checks, so looking at your feet daily is always a really good idea. Look for splits and cracks, especially in between the toes, especially in the summer when things get very hot and sticky. And, you know, we all get hot and sticky feet, so it doesn't just come, you know, with people living with kidney disease. Everybody gets it, so this is something that we all need to sort of make sure that we check in between our toes, we're getting any cuts or splits. And make sure that you've not got any cracks around the back of the heel, because then sometimes, you know, we can develop dryness to the feet, and then we can get fissures or cracks to the back. Check for any blisters, things like that. So look for, you know, visual checks. Look for any redness or discoloration. So different skin tones will give you different color changes. Usually you tend to go on a darker scale. So if you've got a lighter skin tone, you'll go darker. And then if you've got a darker skin tone, you do get quite a depth of color. So do look at that spectrum. So what's normal to you now, if suddenly you've got an area on your foot that's not looking like it was a normal color when you checked yesterday, then actually you might find that you've got some discoloration, and that's a warning sign there might be something going on. So swelling, of course, we've mentioned edema build up in the legs. We can get dependent edema, so when we're sat a lot, so if you're finding that you're finding it difficult to mobilize or exercise, then and if you're just sat in a chair, if you're sat on a train or in a car for a while, you might notice that you get some swelling around your ankles. So, you know, do look out for swelling. But if there's anything specific that looks very different, like swelling in the midfoot, or the big toe suddenly very swollen and it wasn't swollen yesterday, or one foot's really swollen compared to the other foot, you know, because in theory, you know, we're symmetrical, so most things tend to look the same on both sides. And if we have one side of us that's not looking the same as the other, then there's certainly something going on down one leg or within one foot. So look for swelling. Non-healing wounds or skin tears. So, you know, thinking about if with swelling you're quite prone to a skin tear, you might catch it. It leaks a lot of fluid. So just sort of look out for these things. And if you do get them, then you need to seek advice, especially if they're non-healing. And then changes to the skin and nails. So things like fungal infections, look out for those. You know, cracks, splits, thickness of the nails, thickness of the skin, cracks to the hard skin. And even so, you know, maybe you sort of notice that you have, you know, quite a few hairs on your feet for a while, and actually now all my hairs have gone. I mean, hair growth is actually something that is part of a good blood supply. So although we always look at it, you know, aesthetically and think, oh, I've got hairy toes, actually it's a sign of good health in some ways. So if suddenly you don't have, you know, hairs on your feet, and you did, actually you might just start to say, how's my circulation doing? Maybe I'll just get that checked out. Temperature check. So if you notice a change in the foot temperature between one or another, or one toe feels particularly hot, then that might be a sign of infection or inflammation. So, you know, again, with that discoloration of the skin color, like redness or like those darker skin tones or darker colors of the darker skin tone, it's just, you know, just have a look to see, you know, is this normal? But definitely feel for the temperature check. And then, of course, pain. Because although we can develop nerve damage, nerve damage in extreme cases still can give you a pain sensation. But equally, if you don't have nerve damage, then pain is a really good indicator that there's something not quite right. You might have trodden on something, or there might be an internal break, for example, you know, to a bone, or it might be that you've, you know, developed, you know, peripheral neuropathy even, which is that nerve damage to the peripheries, to the down the legs. And that can create pain. People often talk about pins and needles, a tight elastic band around their foot, hot stones, pokers. You know, nerve damage can create a pain sensation as well. So it's not always necessarily due to trauma in terms of an external trauma, a break or a fracture, or you've trodden on something hot. It can be through nerve damage. So just be mindful of any changes in pain, and just make notes of these sorts of things. So when you go to your healthcare provider, you can say, I'm getting pain every day, or I only get it in the mornings and it's just to my heel, or I get it whenever I mobilize, it's really painful. You know, so just be mindful of your symptoms that you're developing. But these are the sorts of things that you can do at home for yourself to take note of what your feet look like, so you can try and self-manage. So the reason we look out for the risk factors, and the reason we think about the levels of filtration rate, we look for blood supply, we look to see whether the toes are deformed, or whether there's any, you know, bony abnormalities, whether you've got any splits or cracks to the skin, whether you've got any history of ulceration or amputation, or nerve damage. These all are risk factors to, you know, leading towards potential ulceration. So in the diabetic foot world, so those people living with diabetes, there's a pathway in place. And I thought it'd be really nice just to share with you what that pathway is, because some of you will be also living with diabetes. But equally, those of you that may not be living with diabetes, you might just like to look at how the pathway works within the UK, just so that you can go, actually, I am a low risk, but I should be able to maybe access this, or this is what I might do. So I just thought I'd bring up here, this is the guidance, NICE guidance for the National Institute of Clinical Excellence, has suggested that we categorise patients living with diabetes into low, moderate, high or active risk. And that's associated with their foot risk. So the patient will come for a screening appointment. We'll be asking the same questions, we'll be doing the same assessments, looking for vascular disease, any neurological changes, any history of ulceration, amputation, whether or not you're able to self-manage, what your level of education and awareness is around the foot, kidney disease factors, so we're looking at all of those things. And then they sort of, if you have one or more risk factors, then actually you're categorized as moderate. So one risk factor would be a moderate risk, and then more than one risk factor would be a high risk. But if you've got no risk factors, then the likelihood of you developing a foot ulceration is low. So then, of course, there's the pathway here. So the pathway suggests that if there's no risk factors, then actually people living with diabetes could have an annual screen. And that's currently the guidance that's being offered. Some areas might suggest more than that might be coming. But actually, at the minute, it's still looking at around an annual screen. They'd like to review your footwear. They would sort of give you, suggestions on what is a good shoe. They'd look to support you with any verbal education, so to support you in understanding, how to prevent complications attached to your foot. And they would look to try and reduce your risk of cardiovascular disease. So that would be things where the hardening of the arteries or high blood pressure. And we'd obviously try and look at smoking cessation advice, so encouraging people to consider reducing their smoking intake, or if they can, to completely stop smoking. So that would be a low risk pathway. The moderate risk pathway is if you've got one risk factor, so you could have nerve damage or peripheral neuropathy, or you might have an arterial complication, so peripheral arterial disease, or you might have an EGFR of less than 30. And what they say with that is that you should have a more regular screen. So a more regular screen by a healthcare professional, and then potentially consider orthotics or footwear, consider reducing your cardiovascular risk. These sorts of things are they're just upping the game a little bit more, but they're looking to do screening is a little bit more often in the low risk, a bit more regular in the moderate. And as you come up into the high risk, they sometimes then look to offer you treatments and management plans by a podiatrist or a foot healthcare professional. So that might be thinking about reducing the callus, supporting if you've got a digital deformity, a toe deformity, making a device that takes the pressure off when you put your shoe on. It might be making you an orthotic or providing you with good footwear, again, reducing your cardiovascular risk. So they start to sort of look at specialising in your care a bit more bespoke in a high risk foot, because they want to not allow you to enter into that ulcerative stage. And that's the active phase. So if you've got an active foot condition, that would be an open ulcer, infection with or without blood ischemia, and also any presence of a swollen foot with or without pain. So something that's actively going not quite right, that's when the alarm bells ring, and when you need to alert somebody to provide you with advice. And in somebody living with diabetes, that access can be within 24 hours to a multidisciplinary team. And for those living without diabetes, there are pathways now into vascular conditions. So there are pathways now considering vascular fast tracking into services to support people with vascular disease. But equally, living with kidney disease, you should be able to access your multidisciplinary teams or your nephrologist, just to kind of highlight there's something not quite right here. My foot's not right, because you are at risk of developing things like arterial disease, nerve damage, and then edema, when actually that can cause a complication. I put on the side here, they're actually little credit card sized cards that you can get hold of. And this is from the Scottish Diabetes for Action group. It's called Act Now. So this is just trying to highlight when you might want to make that call to say to somebody, okay, something's not quite right with my foot. I want to just double check, please. So it's things like, have you had an accident or a penetration to the skin? Have you pierced the skin? Is there a wound? Is there a change to the skin tone? Is there a new pain? You know, is there oozing? Is there temperature change, or have you got a wound there that's not healing? And if you're living with diabetes and you've got a wound, you've got that 24-hour access. So, you know, do consider this sort of acronym ACT now, just as a reminder, really. You know, has there been an accident? Has there a change to the coloration? Is there a temperature change, new pain, oozing, or wound? And that then can alert you to using some of the pathways that are in place to sort of prevent deterioration and ulceration. So do try and remember that acronym. So good foot care and hygiene then, and management. So we like to advise people to keep an eye on your healthy, you know, keeping your feet healthy. So check feet every day and wash your feet every day. And washing should be with warm soapy water, and think of it in between the toes. Sometimes it can be difficult in between the toes, and if you're caring for somebody's feet, then you can use sort of things like little wet wipes that can go in between, just to help get in between, because it can be sore if people are living with arthritis, just to pull those toes apart. But it's really important that we clean in between the toes, because that's sort of a warm, hot, sweaty place. So that tends to be where we might develop maceration or wetness to the skin, or a fungal infection. We like to try and get people to also dry thoroughly. So really try and make sure you dry in between the toes before you start putting your socks and shoes on. But what you can try and do as well is, if you can't reach your feet, you can try and scrunch the towel up under your toes, just to try and get some of the dampness away. Maybe get a super absorbing towel to help, and you might, you know, be able to help support that drying process. Moisturize your feet every day. So we don't want to over moisturize your feet, but equally you do need to maintain good moisture balance, and that's usually around the heels, and underneath the bottom of the foot, by the ball of the foot. But mainly the heels are the area where we tend to see most of the dryness. And so if you're sort of, you know, putting moisturizing cream on your legs, then just literally flip your hand around your heel and just pop a little bit on there, just so that you've actually, you know, try and prevent any dryness or cracks or splits. But the one area to really avoid putting cream, unless you do have a very dry skin condition and it's been confirmed that you need to do this, is to avoid putting cream in between the toes. If you put cream in between the toes, and of course we've just said it's a hot, sweaty place, so actually you can just create more moisture damage. You can create more moisture, which may create moisture damage. So just be mindful of not applying cream in between the toes, because it can get a little bit hot and sweaty there, especially if you've got a sock on as well. Be mindful, of course, talking about moisturizing your feet every day. If you're wearing a sandal, then actually it can be a bit slippy first thing if you're putting cream straight on and then a sandal. So just be mindful if you're walking with that. Obviously, you know, checking your toenails, keeping them nice and short. And we sort of suggest cutting or filing your toenails as advised by your podiatrist or foot healthcare professional, but ultimately that means just keeping your nails to the shape of your toe. So if you've got a very broad toe, then actually you don't want a very thin, pointy nail. But if your toe is actually a bit more pointier than maybe, you know, a bit more pointy, then you can have that shape. So we do advise following the line of the toe. Nails are there to protect our anatomy, so to protect us, because obviously feet tend to kind of go in places that might have been a bit rougher back in the day. So the nails are there to protect the skin on the toe, and to sort of take some of the pressure if somebody stood on you. So they sort of just take that little bit of pressure away. So, you know, they're meant to be there, but sometimes they can, through micro traumas, through, you know, dropping something on your foot, or through someone standing on your foot, they can get quite thick. So if you are developing a thick nail, then you can file on the top of the nail to thin it down. Sometimes thick nails can look discolored, so they can look yellow, and there can be a fear that there's a fungal infection in there. So if you're worried about a fungal infection, then do go and see a podiatrist, because they can help assess and diagnose and give you some advice and support. So, you know, think about your nails as something that needs to be neat, not, you know, so not too long, not too short, because they are meant to support your toe and your skin, but actually, you know, just a sort of couple of millimeters or so you know, of the white of the nail that you can see, just so that it just does protect. But do cut or file to the shape of your foot. And if you're able to do this, that's perfectly fine. You know your feet better than any health and care professional in the terms of how your nails grow. So if you want to continue maintaining your foot care, you should be, you know, enabled to do so. Just be mindful that if there's any changes to the skin, if you've got any thickness to the nails, or you're not able to through either mobility or eyesight change, or you might be, you know, living with poor blood supply or nerve damage or edema, then, you know, you might need a bit of support, and that's okay to go and ask for help from a health professional. So, you know, do just, you know, get the support as you need it. We are there to help you. Footwear and hosiery, so things to consider with shoes and socks. Socks, stockings and tights, they're all perfectly acceptable to wear, but consider the fit. So don't wear a sock that's too tight, it might rub. So consider the ribbing, the patterns and the ridges. So some people find, especially if you're living with edema, then actually the patterns on the socks might create little marks on the feet when you take them off. So just think about sort of the shapes and the patterns that might be attached to a sock, because you might be better with a plain sock so it doesn't create these little marks or indents on your skin, especially if your skin is a bit more fragile, because you don't want to break the skin or create any you know, pressure damage. Equally, don't have too big a sock because you don't want it to ride down and slip off. So it is finding the right sock for you. And of course, we do suggest natural fibers as much as possible. We appreciate that you need to have some conformity and some people require some compression garments. But, you know, equally, if you're buying a sock, then, you know, just have a think about what majority of cotton, you know, is it majority cotton or bamboo or wool? Because these things tend to have good absorbency of sweat if you've got a sweaty foot. But also they can keep you warm. So, and plastics can sometimes just create a little bit extra moisture, and sometimes irritation. So just, you know, think about the majority of natural fibers if you can. Check your shoes. So check your shoes for foreign objects. The amount of times, you know, you might have found a little stone, or you've been out on a walk and you've got one of those little grass feed things that have gone in there. They're quite sharp. So check your shoes for foreign objects. If you're living with nerve changes, you know, again, be mindful of things that might have gone into the sole, because you might not feel these things. So I kind of tend to sort of suggest to patients that they kind of throw their shoe about a little bit, make sure that there's nothing in it, and just check the bottom of the sole to see if they haven't trodden on a stone. And then, of course, wear and tear on the shoe. So just make sure it's still functional. Check the soles for any holes or splits or cracks. Make sure the laces or the fastenings secure themselves properly. You know, there's not anywhere that water can get in, like a little split. So, you know, just look for wear and tear. And you might be wise to double look if you're buying footwear, you might be eligible to have the VAT exemption. So just if you're buying footwear from, you know, a footwear catalogue, then it might be that you're able to claim exemption. So just you know, have a think to see whether or not you'll be eligible for that. Good fitting shoes, of course, would we consider having a fastening of some form. You can see on the sandals at the bottom, there's still a good fitting, you know, shoe. They've got a fastening there to keep your foot in and secure. The trainers there have laces. And of course, the good thing about fastenings, especially when you're living with kidney disease, is if you do develop swelling throughout the day, you can adjust and change the shoe. So of course, every day might be different. So as well as it being supportive and allowing you the shoe to be held in place, it will allow you to adjust and stretch as the day goes on. Think about supportive sole, so nothing too thin and squishy and too flexible. You want a nice sturdy sole that's going to take some good shock absorption. A soft upper, so that's on the top, so there's nothing pressing or causing a blister. And then a good fit, like a depth, width and length. Toe box is one of the biggest ones, actually. If you can get a good toe box, then actually you'll find that will be, and you've got a good fastening, then you'll find that you'll be able to move your feet with ease. So that's a good one. Prescription shoes, of course, if you are living with foot deformity and you've required a prescription shoe, or you've got to have an insole within your shoe, then these will be individual and bespoke to you. So speak to your orthotist or podiatrist, whoever it is that's provided you with prescription shoes. Work shoes can be a bit of a problem sometimes, but you need to think about that supportive sole, because you want good protection. But it might be that it's quite hard if it's got that the metal sole, or if the toe box has got metal around it. So it's, if you're finding that you've got issues or complications, just speak to someone like a podiatrist. You might be able to speak to your occupational health teams and just give some advice on what might be a useful shoe for work shoes. But they are there to protect our feet, and if you are working in an environment where you need to have a bit more protection, like if you're working in a kitchen or on a building site, then do think about having something that can properly protect you. But equally be mindful that you might need some adaptations, so such as an insole or a different style of work shoe. And work shoes can also be made for you, so it could be that you need to have a prescription shoe, but with a more of a work shoe build. So your shoes should fit your feet. Whatever your size of foot, you should be able to find a shoe for it. Unfortunately, a lot of high street shoes don't always offer sort of a bespoke fit. So sometimes you do have to go to different footwear manufacturers just to try and see, which ones fit you. It's a little bit like buying, underwear. Some companies do great ones that fit you and others don't. So it's literally is what feels right and what fits you. And the size and everything is really important to get right. So ask for help if you need that. Immediate care. So what do you do if you develop a minor cut or blister? Obviously we need to consider cleansing it, not breaking any blisters, cover them with sterile dressings, note any color changes, heat, swelling, redness. Inflammation is normal. It's a normal process that our body goes through to heal, but infection is not normal. So that's when the body has bacteria, and that's when you need to get support. But equally, if the inflammation is lasting for a long time, then you need to get some support too. So it could be that there's something not quite right there. So inflammation is red, hot, swollen, but infection tends to develop a malode and a pus, and can be very cherry red compared to that sort of lower graded red, or in a darker skin tone. It wouldn't come through as red, it comes through as a darker shade to your skin. So not a kind of really sort of bright, vibranty color. If you're concerned about infection, I would seek advice. But actually, there is inflammation and there's infection. So, do try and think: does this just look like a normal process, or actually, I've got something going on? Hard skin and corns. Of course, we do sort of advise people to try and file any hard skin, but we do try and sort of give advice around it using any of the over-counter treatments, such as the acids, or the kind of sharp equipment, like sort of the razor style things, only because there can be accidents attached to them. So always seek health professional advice before you do use any of those over-the-counter treatments or those sharper implements, only just to make sure that you've got no nerve damage and your blood supply is okay, and that actually you feel that you're, and it's in a controlled environment. So just be mindful of those. Avoid high and low temperatures, because obviously we want to sort of prevent burns to our feet, and so to try and avoid things like walking on hot sand. If you're going on holiday to a swimming pool, then just make sure you're not sort of on the hot stones going there. And if you do end up burning your foot for whatever reason, you dropped oil on it, or you put it on a radiator, you burnt it on a hot water bottle, do consider running it under cool water for about 20 minutes and seeking advice. Warm feet up slowly. So although we are slightly warmer in the UK at the minute, we have had some very cold temperatures. And actually, if you're finding your feet are particularly chilly, then warm them up slowly. Don't go popping them in really hot foot baths. Let the body naturally warm itself up. But if you're finding that your feet still aren't warming up, and you're sort of looking, your feet are very blue, or they've started to get discoloration, then actually you might just want to go and seek some advice just to check on your blood supply, especially in those colder temperatures when we can in the UK develop things like chilblains. So, do seek advice if you notice anything like that. Holiday feet. Well, it's an exciting time of year here. So holiday feet, when we think about what we need to consider for holidays, sometimes it's the long journey. So we've spoken about swelling associated with kidney function, but equally you've got things like dependent edema, where when you're sat for a long period of time, or when you're at altitude, your feet can develop swelling. So do think about trying to walk about if you're on a train journey, getting out of the car regularly, use your muscle pump in your lower leg to support the fluid coming being pushed back to be drained away. Also, your feet may swell in the heat, so make sure that nothing's too tight on your foot because it may develop and cause a rub. And you can consider things like compression garments, such as flight socks, when you go on long journeys. But just make sure that you've got a good blood supply before you start applying anything too tight to your feet and legs. So, do consider using compression therapy, but equally, we have to be mindful of the kidney that you're able to filtrate that water if we're pushing it away from the feet, and make sure, of course, we have no heart conditions either, but just check for vascular checks as well. So seek healthcare advice. And of course, we want you to check, wash and moisturize your feet every day on holiday. And the biggest one is an SPF factor. So if you are wearing sandals or you are having a sunbathe, then just make sure that you've got the SPF on your feet as well as you have on your face, because actually feet are usually in socks all year, don't get exposed to the sun, and they can really easily burn on the bottom as well as on the top. So just be mindful to put on both, especially if you're relaxing on a sunbed. Equally, though, when you go to stand up, if you put them on the bottom of your feet, be careful you don't slip. And with slipping, of course, you have to consider your footwear. So sandals with a fastening are sort of a preference, really, because then your foot is held in a correct position, and you're less likely to lose your shoe as you walk. Flip-flops and sandals with no backs to them, you do tend to over-grip and hold them on. It's sometimes a bit unconscious, you just get used to doing it, but you might find that over a period of time you develop some soft soreness to your feet. And then, of course, we've got swim shoes, and swim shoes tend to allow us to walk down to the seaside, walk down across the hot sand, across any stones, shells, crabs, anything lovely that you'd normally find at a beach, but actually just protects your feet. And also you can swim in them. So if you're ever getting out of the open water, you'll find that you can get out and it won't be too sore if you're standing on any of those pebbles that we've got on the south coast. So think about swim shoes as well. And there's a link there to the holiday feet on the National Kidney Foundation website. So I'm going to hand over to Ljubisa, and he's going to tell you a little bit about how patients can support healthcare professionals in the delivery of good practice pathways and shared decision making.
Hi, everyone. So thank you for inviting me to this event. So I'm a nurse by my background. I have worked for 15 years as a wound care nurse, and now I'm working as a senior lecturer in adult nursing at the University of Manchester. And we've met with Joe at one conference in this May. And then we exchanged few words and came with a plan that research can actually support also some sort of decision making, and we do decision making every day. So we decide on very small things and also on health related things. And I would say it takes two to tango. So shared decision making is a collaborative process that allows patients and also healthcare providers to make health related decisions together. And in one hand, it integrates clinical expertise, which healthcare providers have, and also patient preferences and values and experience of living with a condition. And this process involves stating that decision has to be made, so that we share information between each other. So on one hand, already I noticed in chat that you have already described your symptoms and issues, challenges which you have. On the other hand, healthcare providers, so Joe in this session, have given a lot of information, a lot of options, benefits, and also possible side effects. Then we will go into the discussion phase. So we will discuss what matters most to the patient and what is the most optimal decision to take, and then consider that in relation again to your values and preferences, and then decided what will work or not. So next slide, please. Perfect, thank you. And considering why shared decision making is important, well, I'll come from the research perspective, and we know that there is only limited research evidence available suggesting how shared decision making affects health outcomes. And one of the studies which was done very recently found evidence of association between shared decision-making and improved decision quality, patient knowledge, and patient risk perception. On the other hand, they found only little evidence of association between shared decision-making and patient satisfaction, quality of life, medication adherence, and also trust in physician. Next slide, please. Thank you. Studies have also addressed what is helpful and what prevents the implementation of shared decision-making. And I wrote here facilitators and barriers, and there are quite some. So for example, effective communication, patient engagement, healthcare support, healthcare professional support, decision aids, organizational and technological support. And the barriers are communication barriers, knowledge and health literacy, our culture, beliefs, and our personal values, emotional, psychological factors, which are very important in decision-making. One might experience anxiety, depression. Also, there are a lot of barriers related to healthcare professionals, as not everyone are keen to take this shared decision-making concept in their everyday practice, I would say, and also there are systemic and technological barriers. Next slide, please. To answer on, so what can I do? There are 3 questions here. So what are my options to consider? What are the possible benefits and risks of those options? And how can we make a decision together that is right for me? And we use 3 talk model. So here on the slide is written, so choice talk, option talk, and decision talk. And each stage, I would say, it supports your decision making. So before engaging in shared decision making, you would usually be given resources, preferably in your preferred format, such as, for example, flyers, apps. They can be also web resources. And these resources should help you prepare by encouraging reflection on what matters to you, your hopes for the outcome of the discussion, and also questions you would like to ask. And I would like to emphasize that there is no harm in asking questions, and there are many resources which can support your developing questions for healthcare professionals. And one of these are on my right, probably your left. I'm not sure how the screen shares. So no harm in asking that. That was produced by Leg Matters, and they're really good questions which can aid and facilitate discussion with your healthcare professional. Additionally, for those who might find it challenging to participate in decision-making, healthcare professional can offer additional support in that. Sometimes there is a language barrier, so we need interpreter, or we don't really understand a lot of those information. So sometimes healthcare professional can help with facilitating understanding those information. Also, during discussion, we often check if you understand what we have conveyed with you. So, and also check that you understand that you can participate in decision making, and it is your choice on doing that. Sometimes we are not ready to do that, but this doesn't mean that you cannot be more active in later stages or other consultations, or when you feel that you are ready to make or be more active in this decision making. Often healthcare professionals will discuss different tests, treatments, interventions. They will address risks, benefits, and patients often get overwhelmed by information. And if you don't understand, you can ask a professional to break down information in more manageable chunks, and you can just signal if you need more time to discuss this further. And I would suggest also that you have to have in mind that you can review and reconsider your decision at any time and ask more questions. So not every decision taken is ultimate decision in a way.
Sorry to interrupt.
Yes.
We've got till 6 o'clock, and I want to try and get all these questions in as well.
Oh, okay. So perhaps next slide, Joe. I will just add one resource. So patient decision aid. There are evidence that this can support and facilitate your decisions, and there are many studies done on that. And it can take different forms and shapes. But what is important that studies have shown that there is a confidence that when you are given this decision aid, you are more likely to choose an option that reflects the features most important to you. I think that that's the main thing, and also that they didn't cause any unwanted effects such as regrets about the decision, which is really reassuring. So I'll stop here because I know that Joe have a few things more to add.
Thank you. This is just literally some touch points where you can get support. So there's lots of websites, obviously the National Kidney Federation, there's also the Royal College of Podiatry, Legs Matter have got some support, and support isn't just formal support, it can be informal support, so family, friends, as well as health and social care professionals. So just a reminder about the Act now, any changes, report them straight away. So in summary, good foot health is important for those living with kidney disease. A good foot care regime will support good foot health. It's important to build good relationships and be engaged with your foot care and seek advice as and when required or when you're concerned. So thank you for listening. And if we have any questions, we're happy to answer them between us.
Yeah, we've got quite a few questions, Joe. So let's see if we can whiz through them. But there's lots of information on our website, as Joe's just put on the screen. So visit there and we can send you them as well if you want to go through the helpline. So first question is, I've been offered foot screening and my GFR, or I have not been offered foot screening, but my eGFR is 11.
Yeah, so presumably you'll be seeing, well, I may suggest you might be seeing a dialysis team. You should be able to ask there if they can check your feet. It is important that you have your feet checked, especially during dialysis, because we know about the fluctuations in blood pressure attached to dialysis. So, you know, you are at a high risk. So you can ask for somebody to support you in a foot screen. Or at least if your dialysis teams aren't, they should be able, well, they may be able to do it, maybe is what I should say, if they've had the appropriate training, but they could signpost you to podiatry, and then foot health teams could pick you up. So, you know, do think about asking for that support when you next see your healthcare professionals.
So similar subject really, someone's saying that it's expensive to see a podiatrist, £55 plus £20 taxi. That's not right, is it? You should be able to see it through your renal clinic. Is that correct?
I think, yes. I mean, there are definitely pathways to getting NHS care. You know, they are dealing a lot with a high risk foot group. So if you fall into that bracket, then you definitely can be referred into podiatry. Your GP, of course, can do your foot screen, or your community teams can do your foot screen and then refer you in if that's the pathway to access podiatry. Private podiatry, of course, you have to pay as you go and as you use it. But it might be beneficial to have a screen and a review, and then work, as Ljubisa has just been saying, work with them to make your own management plan. So it could be that then they'd have to take into account your health economic status as well. So, you know, and they also could be able to signpost you to charities. So people like Age UK can offer foot care services. So, you know, it's probably, if you aren't able to access podiatry within the NHS, then finding podiatry or foot health teams privately might just give you some options as to where you can go to get some of the health support, or even to be able to self-support. You know, so you may find that beneficial.
Brilliant. Another question then, let's speed through them if we can. I suddenly developed fungus while on dialysis, and that shocked me. My toenails changed colour. I had a transplant 8 months ago, and my big toes colour towards the bed has gone dark. I'm very concerned. I'm seeing a podiatrist because my nails are so hard and my husband can't do it as they're so sensitive and I can't bend over.
Yeah, so I think you're in the right place. If your podiatrist has diagnosed you with fungal infection, then I would imagine they've offered you some sort of treatment support, or at least a management plan to help you, manage it. I'm pleased that you're seeing somebody to help you if your husband finds it difficult to do. So I think you've done the right thing there by seeking some support and to getting some action done.
Another question, or a statement really. I've had for a while changing toenails. I've had a couple of curled toenails, pincer nails, where I see a podiatrist, but he doesn't know much about CKD. Could it be connected, the CKD and the pincer toenails?
It's unlikely that you'd get pinched toenails, so that kind of real sort of pointy, sharp, curved sort of approach. They tend to be through micro trauma, so changes possibly to the growing area of the nail. Might be footwear related. They can be, genetic, what we'd call that kind of involuted nail shape or that pinched nail. Your podiatrist should be aware of chronic kidney disease. It's sometimes podiatrists specialize in different areas, but if you're living with chronic kidney disease, then actually, you could talk to them about it yourself. You could help support them in their learning, and equally, they then, should be able to support you in the management. So, if you feel that they're not up to speed, maybe just give them a little bit of support from your side and what you go through.
So another question, I've had a transplant 5 years ago. My foot is very painful after walking around a bit. My ankles swell, and under my foot and heel is very painful, shooting pain, very hard to walk. My big toe becomes very hot and painful, and it's also almost unbearable, even though I have painkillers. That doesn't help much.
So it's very difficult to give advice, specific advice, when I've not seen, and obviously individuals, it's very different. It's always a good idea to seek help from a podiatrist who can do a thorough assessment. Peripheral neuropathy can cause all sorts of pain, and it sounds like you are on pain relief. But I would suggest, especially when you're saying your feet are getting swollen, you're getting your big toe specifically is being swollen, the pain is in the heel, but also you've got pins and needles pains. I would just go and get further advice really and an assessment from your podiatrist, and that can be through referral from the NHS or into the private sector. So whichever you're eligible.
Right, let's squeeze in 2 more questions before we wrap it up.
Yep.
I'm on dialysis, suddenly developed ingrowing toenails. Is that a connection?
So the connection might be swelling. It could be that as you've developed swelling in your feet, because if you're on dialysis, you probably find that you do require the dialysis to prevent some of the swelling, to get rid of some of the fluid for you. So it might be that you developed it through that. In my experience, I don't know, Ljubisa, whether or not you've heard of any link between dialysis and shape of nails. I think probably the external factors that might impact. So things like the swelling, footwear, socks, because of course now if you are developing swelling in your legs and you've got a tighter sock on, that will have an impact on the pressure around the nail in the soft tissue of the toe. So apologies if there is I'm not aware of the connection, but it might be an external factor. So again, you should be able to seek podiatry really, if you've got any foot concerns like that, especially if you're on dialysis.
So last question, and I do apologise if I've missed your questions, but we've just run out of time. So I've been going to a low clearance unit since August 2018 and started hemodialysis in March 2024. I've never been offered foot screening or advice, and I'm not diabetic.
It is difficult. Healthcare services are quite stretched, and it is difficult to often get into pathways if you're not living with a condition that enables you to get that treatment. However, I do feel that there should be some support within the units. So it should be that people can support you in actually having a foot check or a foot screen. It is something that is important to do, because especially as you might be living with arterial changes and you're not aware, you know, you might not be aware of nerve damage. The edema might mean that you are developing pressure sores or pressure damage around your ankles if the footwear's not correct. So it is important to get support. I'd ask the question again, and then maybe speak to your GP and see if there's a way they might be able to refer you, because it might just be highlighting this. And then, of course, if the NHS is able to go, well, there's quite a few people on this ward that might need review, then it will be, you know, useful for them to provide that service. So, but try and highlight it if you can, or get some support from your community teams.
Brilliant. Well, thank you very much for a really interesting webinar. We've had so many questions, so many people joined tonight, so it really is a hot topic. If you want more information, go to our website, because we've got a massive selection on foot care. But thank you for our presenters. They've been brilliant tonight. So have a nice evening, everybody.
Very much.
Thank you. Have a nice evening.
Thank you very much.
Thank you. Bye-bye.
Thanks.
Thank
Bye.
you.